So my name is Steve Beha. I work for the Ohio Department of Developmental Disabilities. I am in the Division of Policy and Strategic Direction, and just want to take a little bit of time today to kind of go over the basics of how our system operates, especially from a funding standpoint, and how services can be delivered in Ohio. So to start with, I want to make sure, Rick, can everybody see my screen okay? Yeah, okay, great, awesome.
Yes.
All right, so the real basic level is Ohio's DD system is largely based on Medicaid and Medicaid funding. And so to understand that, you have to know that it's a federal program primarily that is then administered by each state. So there are basics to Medicaid that every state must offer in health plans, but each state can also make additions to that. Uh, because the federal government holds the 60% tax and the funding formula of this and their statutory authority, they have say over not only the required elements of Medicaid, but also any additional elements that states would like to add on to it. So because of that, the Centers for Medicare and Medicaid Services authorize or have to be given applications for those services, and CMS, as they're known as, has to then authorize those services for states to be able to access the 60% federal match. Why that's important is because if somebody goes to the doctor's office and for every dollar that they spend at that doctor's office that the state reimburses or pays the claim on, we can then turn around to the federal government and get 60% or 60 cents on the dollar back from the federal government. So it's a really important funding formula, but also knowing that because they control the purse strings and the statutory authority, that they also have the authority to approve and deny any type of service or claim that we ask them for. So one type of service that's available in Ohio's DD system are intermediate care facilities, and these facilities have at least 4 people living together. They can be as small as that setting. They can be as large as 100 people within a huge or a much larger facility. ICFs have staff available 24 hours a day, 7 days a week. There's always someone there to help out in the case of an emergency. And like I said, like the unit sizes vary. How each ICF operates looks a little bit different, but they all have folks together with sharing staff throughout the facility in one way or another. Usually folks who live in ICFs will share a bedroom. Again, that's not always the case, but sometimes the case. And they receive a full package of services for their reimbursement. So they will have nurses on staff. They will have the ability to visit physicians and all different types of services that that person may need. So it all kind of comes in a bundled package when they live in an intermediate care facility. And this is something that's fully funded by Medicaid. And that's important when we get to the next few slides about waivers. Intermediate care facilities are considered an entitlement in the Medicaid system. So therefore, states have to offer that service and fund the 40% part of that service. So the bulk of the presentation is going to be around waivers because it seems to be the one that we get the most questions about, and also the one that might be a little bit more confusing. So a little bit of background on Medicaid waivers. They are essentially a funding source for folks to receive services in their homes or in their community that they would usually get in an institutional type setting, a nursing home, a hospital, and so it is a substitute for those services. And so prior to 91, the federal Medicaid program only paid for services if a person lived in an institution or an institutional setting. But then when federal Medicaid waiver programs were began to be approved, those funding streams were able to be moved into what are called home and community-based services. You'll often hear it called HCBS. And those services were then able to be provided within folks' homes, their family homes, their own homes, as well as community settings. And again, just to reiterate that even the waiver services, even though they're not state plan services, all of those services must also be approved by CMS before they can be implemented across the state. So in Ohio, we have actually 7 different types of waivers. I left MyCares off of this list. But the Ohio Department of Medicaid administers the Ohio Home Care Waiver, the Passport Waiver, and the Assisted Living Waiver. You may know a couple of those in the Department of Aging as well. We at the Ohio Department of Developmental Disabilities administer the Level 1 waiver, the Individual Options Waiver that you may hear called the IO waiver, and the Self-Empowered Life Funding Waiver, or SELF, as it's commonly referred to. Each of these waivers require a level of care, or an LOC. For the Ohio Department of Developmental Disabilities waivers, anybody who qualifies for one of those waivers must meet an intermediate care facility level of care, meaning if they did not receive services in their home or in their community out of basic level, then those services would need to be provided within an immediate care facility. And the same goes for a nursing facility. So for instance, the Ohio Home Care Waiver has a nursing facility level of care, meaning if somebody did not receive those services in their home, that they would need skilled nursing care within a nursing facility to provide for those needs. So Ohio is a little different than most states when it comes to the administration of our waivers and the funding of the waivers. So brief background on why we are a bit different. One is just the way Ohio's DD system was formed in the 50s. As many as you know, education laws were discriminatory against children with disabilities to access educational services within the public school settings. And so families throughout Ohio mobilized and created their own schools in their own areas to be able to serve their children who had disabilities and not able to access that public education. In the 1960s, those schools and those programs were codified into Ohio law, and Ohio established county boards of, at that time, MRDD. And by doing that, it allowed them to start collecting local tax dollars and levy on property taxes locally to provide for those services. And that's really important because that was the first funding source and funding base for Ohio's DD system. And that continues to today. You'll often hear of your local county board having a tax levy. And that roots are back in the 1960s from this law. It's also important to note that these local tax levies are very important for the funding of Ohio's DD services overall, because they also go to what we'll talk to here in a minute about the match that the local level provides for the waiver services. In the 70s, as the Rehabilitation Act came through and IDEA, more children had the opportunity to attend public schools, and the focus started to shift more towards adult services and how those would be funded. And again, many times at the local level, that was funded by those local taxes and local tax levies by the local county boards of developmental disabilities. In the 2000s is when Ohio had its first, early 2000s was when Ohio had its first Medicaid waivers approved. So why Ohio is different is because in many other states, the state pays the 40% match. So the same is true in waiver services as it is in state plan services. The federal government still picks up 60% of the portion, but the 40% is left to be paid. In many other states, it is picked up by the state, whether it's Health and Human Services Department. Every state does it a little bit differently. But here in Ohio, because we had the local county boards already established and that tax base already established, the agreement was made that the local county boards would pay the 40% portion for folks that resided in their county who were going to be enrolled in HCBS waivers. And this gives local Medicaid authority to the county boards, which they are the ones who develop what are called individual service. They and all that through the waiver, and much of that is due to the fact that they are paying for the 40% match out of their local funds. We do have state-funded waivers, so there are various reasons why the state will pay for waivers, whether that's because of a hardship at a local level that they are unable to pay for somebody who needs some emergency services. It could be folks that want to leave an intermediate care facility and would like to have a waiver, so we have state-funded waivers for those type of purposes. There's other reasons as well, but the important thing to know is that there are state-funded waivers, and those waivers, the state funds the 40% match. So eligibility, and you can all look this up online, so I don't want to go over each piece of it, but the two biggest parts to be eligible for a waiver is you must be eligible for Ohio Medicaid. So that means you must be an Ohio resident and you have to meet the various financial requirements for that. And then you also have to be diagnosed with a disability that is manifested before the age of 22, likely to continue indefinitely, and presents substantial functional limitations. That is all encompassed in that level of care that I mentioned earlier. Some other requirements is you cannot receive home and community-based waiver services and placement in ICF at the same time. Remember, these waive the entitlement to an intermediate care facility, so they must be used in lieu of that placement in an ICF. That doesn't mean somebody can't go back and forth between waiver services and ICF. They just cannot receive those both services at the same time. So when somebody may choose to go to an ICF for placement for a short period of time, their waiver is then put on hold. And then when they come out, either they are re-enrolled into it, or if enough time has lapsed, then they may have to reapply for one. An important point to know is that the person must require at minimum one waiver service, and that their health and welfare needs should be met through the waiver service. So a lot of folks want to be enrolled in a waiver, but they're not sure what it pays for or what it is. And once they receive one, they're not sure what service package or what service they want to use. But it does require that they use at least one waiver service. Folks can apply for waivers by contacting their local county board of DD. Again, they are the local Medicaid authority. They would want to request an assessment to determine their current or immediate needs. That assessment is done by the local county board of developmental disabilities. And as that process is taking place, having the conversation with them that they do have to become Medicaid eligible in order to receive these waiver services. That is the primary funder of it, is Medicaid. So just a few challenges that we know exist. A couple are myths. One is that there's an age requirement on waivers. Folks are eligible for waivers from birth to death. That's our system is a birth to death system. There is no age requirement to receive a waiver. However, there is a need requirement. So somebody must be able to exhibit the need for a waiver in order to be enrolled in one. And then some folks think that the word waiver is waiving the income requirements to receive a Medicaid state plan card in order to receive those services. You'll hear this oftentimes from families of younger children who the family themselves are not eligible for Medicaid, and they believe it waives their income in order for their child to receive a waiver. And in practice, that is somewhat true, but that is not actually the meaning of the word waiver. when a family is over income for Medicaid, but their child needs a waiver to receive the services to meet their needs, then there's a special income limit that is created for that child by themselves to receive that waiver. So, and waivers cannot be given just to receive a Medicaid card. As I said before, they have to need at least one service that is provided in the waiver that is outside of regular state plan services. In Ohio, we've been going through a transition over the last year and a half. Because there are finite resources, there are waiting lists for waivers in all the counties. And before, those waiting lists were very difficult to manage because anybody could walk into their JFS office and request to be placed on the waiting list. And the administration of those lists became very difficult, and it was hard to know who needed what. So in the past year and a half, we've been going through a transition where it is now a needs-based list. So I mentioned before the assessment for current and immediate needs. That essentially becomes the front door to the waiting list, is determining what needs the person has. Are they a current need that needs to be met within the next year, or is it an immediate need that is more of an emergency type situation? And then based on that assessment, the order of enrollment is determined in each county based on the number of needs somebody has, but it's also based on the local county budget. Remember, the counties are picking up usually the 40% match on waivers. They have a finite resource as well through their local levies and tax base. So the waiting list is often worked based on what local counties can afford. And that goes to the scarcity of funding bullet as well. And then the other challenges, and this is across the board, I think, in any service delivery system, is that the waiver is only a funding source. Because somebody has a waiver, it's access to funding, but there still needs to be a provider on the other side of that funding to provide the service that the family or the person might need in order to receive those services. So just quickly, the big three that are offered within Medicaid waivers: homemaker personal care is what you think of when you think of an aide coming into somebody's home and providing care for them within their home, or taking them into the community and providing care there and support that they need. Transportation, as well as day services and employment services. Each waiver has its own complexities and own set of services that have budget limitations as well as requirements for each one. So I can't get into all of them here, but if you go on DODD's website, there's a nice chart that kind of lays out the difference between the level 1 IO and self waivers. And the biggest thing to kind of take away is for folks to stay informed. Things are changing, even outside of the time that we're in right now. Rules, authorizations, things that may be true at one point in time do change. So it's really important that folks stay informed on what those changes are to Ohio's waiver system. So obviously the department puts out a lot of communication on their website and through various newsletters. We try to get families involved as much as possible to keep them informed and educated. But really a lot of the great information comes from local county boards of DD. They're the ones that know their families the best, that know the service providers in their area. And so they oftentimes have support groups or feedback loops. They have their county boards, so they have board meetings as well. And many of them are very open to questions and being able to support folks through whatever the needs are that they have, with or without a waiver. Oftentimes needs can be met through local county dollars that aren't being used for waiver match. And then we have our trade associations, OPRA and OACB, who also put out a lot of good information. Our PNA in Ohio is Disability Rights Ohio, and our major family advocacy organization is the ARC of Ohio. So they all also put out great information as things are changing. So I don't know if we have time for questions. I'll just that's the end of what I have at this point.